We are facing into the most grave phase of this pandemic. All of our worst fears about COVID-19 disease are staring us in the face. We're asking you, the public, to work with us, to enable us to continue to provide essential services. Our priority is to serve the sickest quickest. Today, about 1 in 4 of our hospital beds across Northern Ireland are occupied by people who are desperately ill with COVID-19. Some of our hospitals are even worse hit. In Antrim, it's nearly 40% of inpatients who have COVID-19. The projection is that by the 3rd week in January, this number will have doubled. This gives you some sense of the huge challenge that lies ahead for us. We need your help. Firstly, we want to keep our emergency departments for the sickest people. We want you to come if you have an emergency need, whether it's a heart attack or a stroke or an illness related to COVID. Our doors are open. But for everyone else, we would ask you to think carefully. Use other sources of advice and treatment before resorting to the emergency department. For people who are in our hospital and are ready to go home, we're asking families and relatives to act quickly to enable us to discharge people who are medically fit. This may mean you taking on caring responsibilities in the short term before a care package is available, or it may mean somebody taking a care home place which is not their first choice. But you must understand how important this is to make our beds freely available for the sickest. The biggest impact immediately that the public will feel is the fact that we've had to defer and postpone some of our surgical procedures. The reality of this is that we need to move staff to where they are most needed. We will reschedule when we can, but for the moment, it is not safe or sensible to continue to provide services and to stretch our staff beyond what is possible. So we are focusing this very, very difficult decision on enabling us to continue essential care. Beyond all of this, I appeal to you, please, to obey the rules. Obey the rules of lockdown, stay at home, reduce your social contacts, wear masks when in public, continue to wash your hands, continue to care and to protect yourselves and your loved ones. That will make a huge difference to us as we work our way through this pandemic. But please know, our hospitals are in danger of facing into an abyss. We need you to be with us. We need to face this together. Thank you.